Welcome to Terror in Bloom, the podcast that brings you voices from the first wave of the novel coronavirus COVID-19 pandemic from Maryland and across the U.S. On episode 4 of Terror in Bloom, interviewees will discuss doing their jobs during COVID-19.
Attention! Shelter-in-place orders are in effect for Maryland.
So I'm a charge nurse on a telemetry unit. We are a 63-bed unit. It includes an ER observation short stay unit. My normal duties include assisting the staff, managing throughput from the ER, which means that I'm looking at what beds have been opened up on the floor from discharges, looking at who's in the ER, studying them to see where to place them on the floor, and then placing them appropriately for the nurses. We also do customer service calls from patients, from family members, from employees. I also make the schedule for the oncoming shift, so determine what room assignments go to which staff member. So really, you're getting to know your floor quite well. For the pandemic, I think I spent most of my shifts passing out PPE, the personal protective equipment. I mean, it would take us sometimes an hour, over an hour even on some days, to hand out the PPE to all of the staff members. And then once you thought you were done, more would show up. Doctors would show up. It was absolutely constant. All of it was locked in our office because everything was being conserved. We were keeping notes, dates, when people had gotten N95 masks, when we had last given them a surgical mask, how many gowns we were handing out to accessory staff, such as our physical therapists, such as lab technicians. We had to track all of that. So I literally spent most of my days managing that. And then silly things like filling, filling bleach bottles so that we would have spray bottles for the staff to use to decontaminate anything that had to go into a room. We tried to keep that as minimal as possible, but there are certain instances that can't be helped, not to mention they want to spray off their shoes or, the shields that they're wearing into the room or their goggles. We could decontaminate everything in between rooms. So helping everyone manage that was a large portion of my time. Assisting the staff with patients who were very frequently, we call it going bad or decompensating. They would lose their oxygen levels very, very quickly. And so learning how to manage them, working with the ICU departments, with our respiratory therapists, doing the extra work to try to get them stabilized and figure out where we were going to go from there is also one of the things that I would help the staff take care of. It's difficult when you have that many patients, and oftentimes there was a lot of patients that was happening to at the same time. And so you were really running back and forth and trying to see who was the most stable as to who you could dedicate your time to help. We went from normal use of PPE was you'd put a gown on, take care of a patient's needs, whether or not it was taking them to the bathroom or doing your assessment or even in an emergency, you would throw that gown away. Well, the cost for the gowns went up 10 times. So the gowns were then, everything was changed by the CDC for regulations. PPE is being reused. Your N95s were then, if they weren't soiled, they were sent off to be sanitized. All of that changed. And then one of my jobs was to educate all the staff and to try to make them comfortable with all of that. A lot of times I wasn't comfortable with all that. So it was a very exhausting process to constantly be explaining to them why we needed to do it this way, knowing it wasn't necessarily what felt right, but it was what we had to do. We didn't have another choice, because if this pandemic panned out the way that they were concerned that it would, we wouldn't have anything. So, people are complaining about having to use a gown over again. Well, we wouldn't have had any left if we had kept throwing them away. So, and that was as a country. So there was weekends that we would get the boxes of supplies on Friday afternoon and said, we cannot use more than this many, or we won't have any by Monday morning, and we will have to wait for the supply truck to come. And that didn't last very long. We found other means of procuring them, but it was tight. So that was a large portion of my job. So I would say it changed significantly with the pandemic. I feel like my responsibility to be a very positive and compassionate outlet for my staff has increased, as well as that role that as an educator that I just discussed. We also did add an ICU to our floor. So managing the ICU patients in conjunction with the sometimes charge nurse that we placed on our floor for them, my role changed significantly in definitely in many ways. We assisted with managing the ICU, educating all of the staff, managing the PPE, as well as the throughput from the ED. Our role expanded significantly. Yeah, there's some very, very sad situations that came out of it. We had to fight for a lot of patients to, for things to happen the right way, even ones who were COVID negative that there was at least 2 others that we fought for to make sure that their family was with them. We had to have difficult conversations. We held phones and iPads up to dying loved ones so that their families could say goodbye. It was, some of the things that a lot of us and anyone in healthcare probably, but there'll probably be some significant time period of having to process some of the essentially traumas that we have handled and been such a significant part of over the last 3 months. It's been very challenging for sure for each of us as individuals, as humans, as nurses. It's been most definitely the most challenging time probably of our lives, I would assume.
There were over 1,000 lawsuits that had already been filed. In fact, I remember when there was one lawsuit that was heard as soon as this thing went public, and that was started. And what's going to happen is you're going to wind up getting judgments in the millions of dollars in favor of plaintiffs, and businesses are not going to be able to pay. And insurance companies, if they do pay, that'll be fine. But I also think there'll be lawsuits against insurance companies trying to force them to pay. And there may be insurance companies and reinsurance companies which go out of business because the courts are going to preside over jury verdicts that are going to be in the billions and billions. And it's already started. The poor you have always with you. Of course, it's going to be small to medium businesses because they're the ones who will not have the funds to be able to sue their insurance company, to compel the insurance company to provide coverage and to make payment on these claims, and to provide defense in a lawsuit.
We were learning as we were going, truly. This isn't a disease that we knew how to treat. So managing each of these patients was a new experience. This wasn't something that normally, if this happens, we do A, B, and C, and then we get result of D. We would do A, B, and C and get a result of Z or nothing at all. And so a lot of the initial patients were truly treated by anecdotal success to try to manage what we could. So it was hard and it was very different. I also spent a lot more time educating our staff on the changing policies. Things would change from day to day. One day it was acceptable for everyone to wear a surgical mask if we were going into the rooms. Then everyone needed to have a mask and goggles on at all times throughout the entire hospital. I've been a nurse for 8 years. And I think in my entire nursing career, I did an equivalent amount of chest compressions from patients who were being coded during the pandemic as I have in my entire 8 years as a nurse. That's how sick these patients were. So everyone was these patients were so sick. And it took a lot of effort and energy from the staff, from, like I said, the respiratory therapists, from the ICU. We stopped having visitors in the hospital. No visitors were allowed to come in at all for both their and our and the patient's safety. In one specific case, we had a COVID positive patient. So his family were his primary caregivers. He was not a fully independently functioning adult. So he's in the hospital by himself. They had put him on hospice and expected it to be anywhere from, days to weeks before he would pass. We had allowed the family to come in and see him. Those were the only patients that were allowed to have any visitors. And so a couple of family members had been able to come in. One morning, another family member had driven from several hours away to come and see him. And the hospital had decided that morning, I mean, it was only 8 o'clock in the morning, had decided that morning there wasn't going to be any visitors. So I had to go down to the lobby and speak with her and explain to her that the administration said, absolutely not, we cannot have anyone in. And she, of course, begged, she cried. She explained that all she wanted to do was to tell her brother it was okay to let go, that it was okay for him to go. I talked to my boss. We fought tooth and nail with the administration. I mean, I think she called in a couple of favors and they allowed her to come up. She had exactly 1 hour. We gave her a mask. We brought her up. She wasn't allowed to touch anything. She'd been waiting for about 2 hours downstairs to get permission to come up. She sat with her brother and he passed a couple of days later. She felt that it was productive and she was incredibly thankful. She wrote us a very, very touching letter thanking my boss and I for fighting so hard for her to be able to come up. She sent us gift cards to his favorite restaurant. It was, so I felt like, so that's one of the really good memories that I have from the pandemic. That's a sad but also positive memory.